Welcome to the Topic of the Month with Kim Wardlow, an AINC original podcast. It's not easy being blind or going through vision loss, but we'll help you navigate these waters. Press on. Push forward. You've got this.
Hello, this is Kim Wardlow. I am your host for the Topic of the Month, a podcast brought to you by the Audio Information Network of Colorado. We have a topic of interest each month. This month is advocacy. You can go back to previous months. Last month was talking about mental and behavioral health. So if you're interested in that, you can go back and listen to those episodes. But this month, this is our final week for advocacy. And we started out with some general discussion about being an advocate for yourself in different situations and even with your own friends and family. And then we talked about transportation and the workplace. And today we're going to talk about medical situations, going to the doctor, going to the hospital, the emergency room. And again, today I have as my guest Lorraine Hutchison. She is a vision rehabilitation teacher with the Division of Vocational Rehabilitation. She's based in Grand Junction. So she's had many years of work experience helping individuals with vision loss, but she also was married to a gentleman who's unsighted and so has her own life experience as well to draw from on this topic. So welcome again, Lorraine.
Thank you.
And I know you mentioned that you have so many scenarios for this topic. So I guess we could just dive right in. One thing you mentioned to me was just the forms. So if you're making an appointment and you have to fill out forms, and there's usually portals, and sometimes those aren't accessible. So even just before you even get there, the preliminary things you need to do for an appointment might be problematic.
Right. Yeah. Well, certainly. Yeah. A lot of things. When you make your appointment, sometimes they have an early check-in. They will have you sign up to go into a portal through your insurance company or the hospital itself, and you sign in and get your check-in kind of done or started, as it were, before you go in to the appointment. And oftentimes these are not accessible. They may send you a text to confirm or cancel your appointment. Unless you can text and you have good skills, well, even to do the online portal, many of my people that I work with do not have computers, or they may not have the skills to be able to do something like that. So right away, that's a barrier.
Mm-hmm.
And then something that horrifies me that I hear more and more from people, because I deal solely with people with vision loss, is that their ophthalmologists. I just had a lady 2 weeks ago who's come in to the office who said that the ophthalmologist that delivered the news about her vision was very unempathetic. I've heard people say, well, yeah, you're probably going to be blind and, well, nothing we can do. And just matter of factly. And this is just devastating news to a lot of people.
Mm-hmm.
And I was at a conference once, and there was an ophthalmologist there who, incidentally, lost a lot of vision himself, and he had to see an ophthalmologist and was stunned at the lack of empathy and what we referred to as bedside manner. So hopefully those things will change and those people will get more training. But then that's where we come in, is to work with the person holistically after the vision loss. So hopefully we can look at those areas of, psychological restoration. Do you need counseling? Do you need help with your daily living skills, mobility and orientation, dealing with your family? I mentioned an incident earlier where family members just weren't coping. So, yeah, certainly we could make improvements, though, when they get their first diagnoses or prognosis, whatever. I had just a very difficult experience myself. My husband was blind when I met him, lost his vision as a youngster, and had a lot of problems with his eyes. When you have something that doesn't work, can give you problems. So he had a lot of issues with corneal ulcerations. He had high pressure, glaucoma-like symptoms, a lot of eye pain. He was developing a lot of trouble with eyes that really didn't work, but they still looked pretty normal. And of course, when we have body parts, we want to hang on to them. So I went in with him to see the ophthalmologist to discuss enucleation, which means taking out your eyes.
Nice. Mm-hmm.
And I was upset, and as was my husband. And he said, well, I don't know what you're worried about. Your eyes don't work anyway. And I just thought that was very callous and
kind of discounted that this was still a major surgery.
Oh, well, yeah, that too. But it was just so inappropriate and unfeeling. And, but that is can be typical of what people are told. I mean, yes, it was the truth, but that certainly was not an empathetic answer and not very professional.
Right.
Yeah.
No, and there's the whole process then of getting prosthetic eyes and all of that too. So,
right. Yeah, and it's a loss. Even though there was a loss of vision, it's another loss to have to deal with. So, and then people complain that they go in, and unless somebody's pretty clued up, sometimes the doctor or nurse will talk through the other individual that is accompanying them, the person with sight loss. And that happens in many instances. So that itself can be a little demeaning and, a little frustrating, put it that way.
Mm-hmm.
So those
Definitely.
are just a few things that make it difficult in getting yourself to the doctor, transportation. And do you take an advocate with you? Will you remember to ask all the questions? And then forms, you're given forms straight away at the hospital. You may need help to fill them out, but, do you want a nurse to come out to the waiting room and they ask you questions like, well, are you a smoker? Do you drink? Have you ever been arrested? Some of these questions that are highly personal. And so it makes it awkward.
It does. So in working with individuals, what do you recommend? I know in the transportation segment, we talked about being prepared for things that might happen. And what would you do if this happens? So in being prepared, what would you recommend in that situation? Sometimes you're making a regular annual exam or appointment in advance. And that's one situation. Maybe if the online forms aren't accessible, you could call and explain and, ask. Maybe they could help do that over the phone or something. But sometimes you might, as you said, you might be in an emergency room and you can't do that ahead of time. So what do you recommend to someone? Because I, as a sighted person, am not going to be announcing all my personal information as I'm writing it down. So if I don't have sight and do need that assistance. Maybe I have a friend or family member with me that can help me. But even then, if you're having to communicate answers to that person, should a person ask and say, is there a private room that we could go
Oh,
to complete this?
yes, absolutely. And as much as you can do, like if you're going yourself to the doctor and you don't have somebody, perhaps you could call ahead of time and say, if we can't do it now, this is personal and I don't want other people to hear. Take me back in the nurse's office or whatever. And, that would also be the situation in an emergency room. And those places are usually full up. They're very busy and a bit frantic. So definitely they should be treating you as they would other people. And they're not asking other individuals to divulge that information in front of everyone else.
Right.
If you were having an eye injection, I had, when I worked with older people, many of whom had macular degeneration, they would have to have an intraocular injection of Mylea or Eylea or Avastin, which helps slow the progression of macular degeneration. And then let's say they were able to still drive. Well, no, your vision is compromised for a while after that. And then also, even when you're getting a standard exam, sometimes they dilate your eyes, and the light is just really, really glary, and so your driving could be compromised.
Right.
So in those situations, you would want somebody to come with you to give you a ride home. Yeah, just to be safe.
So I'm curious about if I take someone with me and then I'm interacting with a doctor that perhaps hasn't worked with many individuals with vision loss, hasn't really been trained in that area. And what do I need to be asking them for so that one, they're communicating with me, but they're not just nodding their heads or, it's not just body language that I can't see.
Yeah, that's a very good point. It's important, I guess, anytime somebody with a vision loss, if they're comfortable, that this is it, they have to be comfortable to be able to say to a doctor, they may have a vision loss it's not evident, it's not visible. And if they are comfortable to talk about it, they might say, look, when you're talking about my vision or what to do or what not to do, if I can't see you, I might ask for further explanation. And if you can just verbalize instead of pointing or nodding your head, that would be very useful to me. But Kim, there are a lot of people, depending on where they are with the acceptance stage, they may not want to reveal the depth of their vision impairment. They may not want people to know. I was just on the phone with someone today who needs white cane training, but he doesn't want to do it in his own neighborhood. He said, I don't want people to know that I have a vision impairment. I want to go to the other side of the city. And I said, well, that's not going to be very useful for you. You really need to know your own area. He said, nope, I won't. I'm not going to. I don't want people to know. I have a girlfriend. I don't want her to feel vulnerable. So he was adamant about it.
Wow.
For whatever reason. So that's number one, that person feels confident to be up front that they do, in fact, have a vision impairment that's somewhat severe. Yeah. And then if not, really, I can't dictate to them what they should or should not do. Yeah, they have to decide themselves. I can only suggest. But yeah, that certainly would be help if you could talk to convey your needs to your healthcare practitioner.
Well, and just before we started today, you were mentioning a client you were working with, and it may have also happened in your own personal experience as well, where if you do take someone with you, often the person with the vision loss somehow becomes sort of invisible, even though they're the patient, and it's the other person that the doctor is speaking with.
Oh, yeah, absolutely. That used to happen to me all the time with my husband. And I know it happens to me when when I'm out on lessons with people and we go into different places. And incidentally, it's just not with people with vision loss. But even I've talked to people who've been in wheelchairs or maybe have hearing impairment, same thing. And I think it's a level of discomfort and people, help, I don't know what to do. So they go to the next person. But certainly you could say, and I know that my former husband would say, excuse me, I'm the one that has the issue. I have the doctor's appointment. So what was your question? And, you do have to be somewhat assertive. And nothing's wrong with my ears. So you can talk to me and address your questions here.
Yes, to be sure that you're getting the services that you need, especially medical services. That's so important and so critical.
Yeah, and hopefully by doing that, instead of allowing that to continue, to have the doctor talk through whomever brought you to the clinic or what have you, you're teaching them for the next time. So, yeah, it's really important to try to speak up because you can be an educator. You don't need to be rude, but you can be somewhat assertive.
So, Lorraine, we've talked about several subtopics in the medical area, forms, working with your doctor, privacy issues. Is there anything else that you, in your years of experience, that you've seen that you want to alert our listeners about advocating for themselves that's related to a medical type of situation?
Well, yeah, it's, I can tell you of a situation that was really kind of, it was just extremely unusual, but I guess for listeners, maybe not so. My ex-husband and I used to do a lot of tandem cycling. And of course, he sat in the back and he was the stoker and I was the captain. And we had an incident where the tires blew both at the same time and we came off and he had badly hurt his hand. And so we walked to a place and asked if we could wash up and, did they have a first aid kit? And the guy, of course, talked to me, not my husband, but took him by the arm, calling him Sonny. Come with me, Sonny, like he was a kid, and forced him in the back and put some of this kind of antiseptic soap on or something like that. Oh. He was absolutely just taken aback. I mean, it was really kind of inappropriate. So we always had a joke about someone who was a green soaper. That was our little code word. Beware, green soaper. But yeah, that was quite, and it happened so quickly, I wasn't even able to intervene. And he was put in a difficult situation. hey man, knock it off. But on the other hand, the guy thought he was doing the right thing. But would you do that with someone that could see? I don't know. So yeah, it was very offensive. It was very humiliating. And then, when my husband had a hereditary issue, and of course we had done a lot of, got some gene counseling therapies, and his sister had the same thing. And so, we were very careful about when it came time to having our own child. And I remember people coming up to me, work colleagues, I don't think it's a good idea that you're pregnant, that you're having a child. Isn't this something that you could pass on to your child? And I thought, jeepers creepers, that's really nobody's business. And I was taken aback, and I was really quite offended.
Mm-hmm.
There is something, a lack of privacy that seems to occur with people who approach people who are blind. I don't know whether it's because there's a lack of eye contact, that I was astounded how many people would come up and ask my husband how long he'd been blind. Was it an accident? People would come and lay hands on him, wanting to pray for him. Just a lack of granting personal space and asking really intrusive personal questions. And my theory, which I still stands, is I think, when you can look someone in the eye, I don't think you go there. But when someone can't see, maybe you think that you have license to ask personal questions. So anyway, I hate to end on a negative note, but
But that's true. And your description of the bicycle accident, I think sometimes it's not necessarily an accident. I've known people who were, drug across the street that they just crossed because somebody was just so sure they needed help and just grabbed onto them when the light turned and said, "Here, I'll help you." And it's like, no, no, I don't need help. What do you advise people in those situations? As you said, it can happen so quickly. And certainly, I think most of us, if somebody just grabs a hold of us, we're not going to react well to that and not appreciate that. But so what do you advise people to do in those moments when something happens so quickly, and you really do need to communicate that that's not okay?
Not okay. Well, again, I know it would be very easy to swear at them and use rude words. Unfortunately, they're going to remember that, and then they may be less likely to offer help. In this case, it happened so quickly. I think my ex-husband said, well, in future, please ask me first. So if you can, hey, wait a minute, where are we going? Who are you? Stop. And there's nothing wrong with that. We have a tool in our toolkit that we teach people. If, for example, someone does this, like pulling you across the road, it's called the Heinz brake, and it's a way of disconnecting with someone if they grab you without hurting them. And so you would definitely use that tool. And again, if you can, try not to be too rude, but assertive. Just stop. I don't want to go across the street. Please leave me alone. Something like that. But although these sound like things that don't happen very often, they happen more than you think. They really do, especially if you're someone who's blind that's out and about a lot. There is, unfortunately, a lot of ignorance out there, and we need to do a better job of educating our public.
Well, thank you, Lorraine. This is wrapping up our our month of advocacy, and I think just with an encouragement of advocating for yourself. And it can be hard at times, but it's really important, not only for you, but for the next person that they may meet who has a vision impairment, because if they can learn the appropriate way to help or appropriate question to ask or not to ask, then that may help another person down the road. So thank you so much.
Absolutely. It's been my pleasure. And I hope that some of the things, little bits of information that we both have been able to provide have been helpful to some people out there. Not only the person with the vision impairment, but the not the caregiver necessarily, but the parent or the spouse or the girlfriend or boyfriend, because what happens to them also affects the person with them. So it's really important that people be educated. So thank you for the opportunity to join you.
Oh, sure. Well, thank you, Lorraine. If you are listening and you have questions or comments, if there's something that we touched on and you were hoping for more information, if you let us know that, we can try to follow up with you. You can contact us through our website, which is aincolorado.org/podcast-guest/. We'd love to hear from you. Next month, in November, our topic is disability awareness and education. So a little bit, we're kind of giving you a little bit of a preview here as we've talked about advocacy and how advocacy can also be educating others. And we'll be talking a little bit more about that and additional items along those lines next month with our disability awareness and education topic of the month. We also have other podcasts that you may enjoy. Blindsight was our new podcast that launched this month, and it is hosted by Bill Lundgren, a certified therapist, and he is talking to other professionals about various aspects of behavioral and mental health and diving deeper into some of these issues. So please look for that podcast wherever you listen. We also have Aftersight, which is hosted by Penn Street, and that focuses on individuals that are having their life after vision loss and carrying on with their life, and typical things that we all do, but then some amazing things too. So that is always entertaining. Please listen to that as well. I think you'll enjoy it. So thank you for listening to the topic of the month this month. Previous episodes are available. If you've missed them, please go back and listen. And hopefully this has provided some information that will help you in your day-to-day life. I'm Kim Wardlow for the Audio Information Network of Colorado.